Hello. Today, I'm going to show you a live thyroid nodule surgery of this patient in the OR. But this is no ordinary surgery. In this, we will help the patient to build a career. We will treat his thyroid nodule without any surgery, without any blade, without any scar, so that he can advance his singing career. Like many of us middle-class people, he is an average working IT professional but has a great interest in singing. He used to post part-time videos on Instagram. Some composers noticed the voice in his video and offered him to collaborate on some projects. Now, the problem is that there is a lump in his throat. He had hidden it with scarves and mufflers in the Instagram videos. But now when it was time for a live recording, he was very scared that the cosmetic lump that was showing in his throat would look terrible and might end his career even before it began. He went to many surgeons to find out if there was any surgery that wouldn't. He leave a mark where this nodule could be removed from under the lip or behind the ear. He read a lot about all these techniques, but the surgeons told him that your nodule is quite large, almost 24 milliliters, and therefore it would be very difficult to use these techniques. Open surgery would be best for you. The recovery period after surgery would take 2 to 3 weeks, and the scar that would appear could be quite prominent for months. Even after second down, the scar would still be visible, and the fear of having to take lifelong medication for thyroid and calcium levels greatly troubled him regarding his future career, which was truly his passion. Therefore, he began researching how he could naturally reverse this. After following 1,000 things like homeopathy, Ayurveda, naturopathy, and diet, he was not finding any success. Then, somehow he stumbled upon our video on YouTube, learned about our technique, and was very skeptical about whether this was an authentic treatment. Is this a hoax? Does it really work? He has done so much research that when he came to me, he was discussing things with me like, "Sir, you will do hydrodissection with an adequate amount, right? So that you can burn on the margins without the risk of burning the medial ganglion, meaning the surrounding critical structures." I was very surprised that I was talking to a patient who seemed to know this nomenclature as if he were a medic. Anyway, one small challenge was that he had put a lot of his savings from his IT job into some instrumentation and particular investments for his career. Considering the future potential, he did not have any medical gain and did not have the money to afford this treatment. Then we offered him the workshop option, that how we could try to do this treatment, which normally costs around 1,70,000 to 2 lakhs, for 25,000 to 50,000, where only the bare minimum hospital cost and basic antenna cost would be covered. And this way, he could get the same procedure at a very subsidized rate. And what happened next? After the basic workup, when we saw that the nodule was non-cancerous, we decided to do thyroid ablation, which you have been seeing since the beginning of this video. The ablation procedure was simple. We made a small needle insertion on the skin and into the corner of the nodule so that when we actually did the ablation, it would be completely unnoticeable. After that, we did a special hydrodissection, which means we injected a lot of saline around the nodule and the nearby critical structures so that the nodule would float in the saline we were injecting and move away from the surrounding critical structures. The benefit of this is that when we actually burn the nodule, there will be no effect on the surrounding structures like the voice nerve or the structures that manage the eyes. After this, if you look at the center of the nodule, you will see the pitch black area. The black area refers to water or colloid fluid, specifically old blood. First, we took a needle and drew water to absorb all of it, so that when we burned it, unnecessary heat would not be wasted in the water, and no water vapor would be produced. Water vapor did not form, and as soon as it was finished, the entire have not collapsed. Then we will take our microwave special antenna and completely burn the knot. Step by step, this whole technique is called the moving shot technique. With this technique, we burned the corners of the nodule, solid areas, so that the nodule would die, and gradually, when the body sees that this nodule is dead, it will absorb it and shrink it away completely, leaving a small scar. The patient was very happy because we had told him that it would take 6 to 9 months to shrink. However, he noticed that it had shrunk immediately. Fortunately, because it had absorbed all the water, the 24 milliliters mass hardly became 5 or 6 ml and stopped being visible from the outside. The next day, specifically 48 hours later, he called us and said, "Sir, that small hole from the needle is completely gone, and the actual procedure is scarless with 0 recovery time." He was so happy that as soon as the procedure was done, he could start his practice the very next day. The risk of voice change was completely absent, and he did not feel any roughness or moisture in his voice even for a single day. So friends, we are continuously sharing live videos for your awareness so that you also realize how good minimally invasive alternatives are to surgery that can completely cure a thyroid nodule, especially if it's non-cancerous, without using any blades, without any scars or marks. No need for lifelong medication, no risk of voice change. You will not find a better and safer effective alternative than this. For the treatment of thyroid nodules, especially if the nodule is not very large, small, and treatable by ablation, of course, if it's large, then in multiple sessions, this same treatment can be done. If it is very large or there are multiple nodules, there are alternatives available today, such as thyroid embolization, where we can eliminate those nodules through angiography. But yes, the point is that I urge all of you, like these patients, to do a little research on these techniques even today. Yesterday, I saw messages from patients saying that I spent 2,50,000 on this treatment in Delhi, and it didn't work for me. This treatment is a waste. I think that is a very irrational conclusion. Just because one patient had an appendix operation and it was unsuccessful doesn't mean we shouldn't do appendix operations. If everyone reaches that conclusion based on that experience, many people's lives would be at risk due to appendicitis. We still know that the efficacy rate of any surgery should be above 95%, and the complication rate should be 1 to 2% for it to be a very good surgery. The benefits outweigh the risks by 100-fold, meaning the benefits are 100 times better than the losses. Sure, there will be failures in some cases, complications may arise, but in maximum cases, benefits will be received. And as for the cost, I believe that if such a heavy cost is incurred and then it fails, it does hurt. Therefore, every time, I request all of you to please keep a good insurance so that you don't have to spend money out of pocket. In case of any emergencies, we have some patients for whom we had to do 3 sessions. The lump was so large, but because they had insurance, all 3 sessions were completely cashless, and they didn't have to spend a single rupee from their pocket. So I hope this video has been very helpful regarding the big guard we talked about. I am providing the link to the live demo of the thyroid embolization technique, and I am also providing a live demo of the thyroid ablation. You can take more information by looking at this, and I hope this video helps a lot. Please do share with your friends. Stay safe, stay empowered.